I really want to start by echoing gratitude to our host here at Trinity Church. As someone who goes to a church every Sunday, it is wonderful to be in a faith community that is welcoming us in instead of trying to keep people out. I think particularly we need to be cognizant of our kind of faith and religious leaders as well as our lay leaders who are leading and building truly in a collaborative and a community-oriented manner, especially during Women's History Month. And so during Women's History Month, I want to acknowledge really how grateful I am as a New Yorker that we do have a mayor who's part of the Men Who Get It caucus. Ashwin, I'm going to borrow that phrase, particularly whenever my husband may need to be reminded that he too is part of the caucus. And just how thankful I am to be raising a daughter and sons in this city who get to see such extraordinary women leadership kind of at the top, as we heard from our first deputy mayor. I also want to say thank you to our terrific, brilliant, and tall health commissioner, to Dr. Morris and Dr. Hayes, and the extraordinary leadership that we have every day in this city. That I'm very proud to call home, and yet we know isn't all that it should be to all of its residents. I think I see lots of heads nodding. For those of us who are proud New Yorkers, we want to believe that this is the best place on earth. And it could be, but it isn't always for our Black and brown birthing people. And yet, as we heard from the commissioner, and as you will hear from others throughout this morning, we know how to build the cavalry that Ashwin talked about, that his mother would marshal and deploy for mothers who were in distress in Chicago. We know what it takes to build wraparound services. We know what it takes to build stress-free neighborhoods. We know what it takes to ensure that every birthing person has access to a doula, a midwife, to all the care that she believes she needs and that her providers believe that she needs. And yet we aren't yet doing those things. And I find this especially challenging here in 2024 during Women's History Month because we have continually failed to live up to, I think, the promise of what it should mean to live here in the greatest place on earth. And when we know that 75% of maternal deaths in Black women are preventable, it's just unacceptable that we aren't moving with urgency and purpose and deliberation. And so we certainly here at the Clinton Global Initiative, stand ready to help support in whatever way we can. And while Ashwin said, be careful about asking for money, I'm always really happy to ask for money for the urgent priorities that hopefully prove what we can be when we are at our best. And so as you'll hear from Sarah and others, we do think we need to raise about $11 million to help fully kind of fund the first wave of work, and also to be mindful that it is only the first wave of work. While certainly kind of cutting maternal mortality by 10% is an ambitious but hopefully realizable goal, it can only be kind of the first mile marker. It cannot be the end state. We cannot mistake progress for success. And so we need the funding to hopefully prove to ourselves what is possible, but also then to set the next horizon of what we know we need to do to ensure that every person in this city can feel safe and supported and cared for, particularly our birthing people and our youngest New Yorkers. So we're very proud to be here. I'm very happy to always be deployed, looking at Ashwin and my friend Michelle Morse, to ask anyone for money or advice or both. Because we need everyone kind of in this work so that what we believe will be collaborative will also be communal, and fiercely so. So really proud to be here, looking forward to the work together, grateful for our extraordinary leadership at City Hall, very grateful to be in this very kind of sacred space as we talk about kind of truly the sanctity of life. And really now I'm happy to hand the podium back to Sarah to lead us forward this morning. Thank you all so much.